Introduction. A virus infection occurs when a virus enters a host organism body and invades its cell. Viruses are microscopic pathogens that can replicate only inside living cells. Once inside a host cell, they hijack the cell machinery to produce more virus particles, often damaging or killing the host cell in process. This can lead to various symptoms and disease ranging from mild cold to severe illness. The immune system typically responds to fight off the infection, but some viruses can invade immune defense and cause persistent infection.
Finally, our class is done, guys. Do you guys understand what this topic mentioned about?
Maybe, but for sure it's about the virus.
I don't want to talk it because I'm so hungry right now. Oh, okay, let's go.
Alright, let's go. We go eat. Okay, let's go. We go outside first waiting for Helen.
Okay, let's go.
We want to sit while waiting for Helen.
You sit there.
Okay, let's go.
Hello, mommy. Oh, really? There she is.
Hi, Helen. Come here, join us.
Helen, why you look so sad?
Do you have any problem?
I received a call from my mother. She told me that my uncle and his people went out.
Do you know what is disease that suffered by your uncle now?
I don't know because the doctor not already to tell my mother. Before this, did you saw any signs and symptoms that different happened to your uncle?
3 weeks ago, my mother told me that my uncle always
Coughing and sneezing.
May I know, do he also have this kind of symptoms such as fever and headache?
yes also have a symptom. I also remember that my uncle started suffering this disease after he met a friend from overseas. That's what we learned earlier. I think this symptom may be occurred by influenza.
Yeah, this disease also transmitted through respiratory droplets and aerosols that contain virus particles.
This disease also can spread through breathing, talking, coughing, and sneezing.
May I know how the doctor identifies this disease?
In this situation, usually, hospital will use a few different lab tests to confirm this disease, such as red time and viral resolution in cell culture.
Real-time PCR has replaced greater sensitivity and shorter times around.
While for viral isolation in cell culture is a golden standard to diagnose this disease, but it's consuming a lot of time.
Then, in lab tests, we also use a various sample, such as throat swab and nasal swab.
Okay, other than lab tests, we also use microbiology tests to identify this disease, such as blood culture, sputum culture, and nasal swab. Alright, for the first one, I will explain about the blood culture. Blood culture is used to detect bacteria and fungi in our bloodstream that indicate systematic infection.
For the sputum culture, it is to diagnose infection of the lungs or airways to identify bacteria and other organisms that cause by distribution.
And nasal swab culture is to detect bacteria or fungi colonizing the nasal passages and help diagnose infections like sinusitis, rhinitis, or nasal polyps.
Do you guys know what kind of the treatment? For the treatment, medication that combat virus infection are called antiviral drugs.
But not all antiviral drugs are effective against viral infection that are available to treat them.
Also, antiviral drugs work by interfering with replication of viruses.
Okay, thank you for the sharing.
mom tell me that my uncle has influenza. See, this is from the symptom. Yes, sir. Can we go now? Okay, let's go.
Example of virus infection and the causative agent. The common cold mainly caused by rhinovirus, coronavirus, and adenovirus. COVID-19 caused by the novel coronavirus SARS-CoV. Influenza, flu caused by influenza viruses. For the HIV, the causative agent of AIDS.
For clinical characteristic or finding, they will often target specific age groups such as infant or young children that can cause encephalitis, meningitis, gastroenteritis, and respiratory disease that include fever, cough, sore throat, runny nose, headache, muscle ache, and fatigue.
Pathogenesis and pathogenicity. Viruses infect a host and attach themselves to a cell. As they enter the cell, they release their genetic material, forcing the cell to replicate the virus, which then multiplies. When the cell dies, it releases new virus that infect new cell.
Transmission. Viruses can spread in several ways, including through skin contact, transfer of bodily fluids, contact with faces, ingesting contaminated food or water, inhaling airborne particles or droplets, and touching an object that a person carrying the virus has also touched.
Then for general diagnostic method, for sample, such as nasopharyngeal swab, blood, sputum, gargle, and bronchial washing, cerebrospinal fluid, and tissue biopsies or post-mortem.
Media and technique. Viral cultivation is viruses are grown in continuously growing cell lines for detection. Direct detection is involved detecting variant, viral antigen, or viral nucleic acid in patient material. Immunological based technique is enzyme linked antibodies are used to detect specific antibodies or viral antigen in human specimen.
Result interpretation. Virus isolation. Identifying the virus in culture cells is a gold standard for diagnosis. Serology, detection and measurement of antibodies in the patient serum are used for specific purposes. Nucleic acid detection, sensitive assays for detecting viral genetic information have replaced virus isolation in many cases.
So, for the conclusion, virus infection are diseases that can cause changes in the way our cells work, which can have different effects on the type of virus that affect us. Understanding the mechanism of transmission, replication, and their interaction with the immune system is important for developing effective prevention and treatment of virus infection.